Hello everyone, welcome to Test Your Knowledge of Heart Anatomy. Here you are going to have to be able to identify parts of the heart, and then of course as we go through this we're going to go over how blood flows through the heart as well. So of course wherever the arrow is pointing, that is what you need to identify. So that arrow was pointing to the aortic arch, and remember the aortic arch is the first part of the systemic circuit taking oxygenated blood to the rest of your body. That was the pulmonary trunk. And the pulmonary trunk, right, is receiving deoxygenated blood from the right side of the heart. And then that's going to bifurcate into the pulmonary arteries, sending that deoxygenated blood to the lungs. That arrow was pointing to the left atrium. And remember, the left atrium is now receiving oxygenated blood from the lungs through the pulmonary veins. So the answer was the left pulmonary artery. That is taking the deoxygenated blood to the lungs where gas exchange takes place. And that, of course, is where the blood is going to become oxygenated. So that was the superior vena cava, also sometimes known as the precava. Either answer is correct. The superior vena cava is receiving the deoxygenated blood from the top half of your body, right? It basically is in sequence with your brachiocephalic vein, where the jugulars and the subclavian veins converge. So the answer was the right atrium. The right atrium is, of course, receiving deoxygenated blood from both your superior and inferior vena cavas. The inferior vena cava, of course, bringing deoxygenated blood from the lower half of your body. The answer was the bicuspid valve, also sometimes known as the mitral valve or the atrioventricular valve. There are always several names for these things. Either one will be okay on an exam or a quiz, but it's basically just the bicuspid valve. That was the left ventricle. And right, the left ventricle is receiving blood from the left atrium. That blood flows through the bicuspid valve from the atrium into the ventricle. And at this point, right, it is oxygenated. That was pointing to the pulmonary veins that are bringing that oxygenated blood back from the lungs and into the left atrium. You guys should be noticing by now that the left side of the heart is involved with oxygenated blood and the right side of the heart is involved with deoxygenated blood. So that was the right ventricle, which receives deoxygenated blood from the right atrium. That was the tricuspid valve. So the deoxygenated blood is flowing from the right atrium through the tricuspid valve into the left ventricle.